A very good day, my dear undergraduate exam going students. As we had discussed earlier, we shall be continuing with systemic pathology. The catch in systemic path is there will be questions almost everywhere and they will be connected by either MCQs or Viva OC, etc. And sometimes seemingly unimportant ones are very common university short questions. Now let us go to the topic problem. In this class, I have got three disorders, namely gallstones. When it comes to the gallbladder, there will be the gallstone, which is the main thing. If you go to my class as well as to the books, you find that there will be three types of stones: cholesterol stones, calcium carbonate, calcium bilirubinate. And go to your book again and be very careful in seeing whether there are pure stones or there are combined stones. And sometimes there can be a mixture of the pure and the combined, and they are called as mixed stones. See whether this particular classification you are able to get. You will have to memorize, because cholecystitis, cholelithiasis can be a specimen, and they will invariably be asking you all this. The next one that you will have to mention will be the pathogenesis of the gallstones. So see whether there is a process of initiation, propagation, particularly in cholesterol. So there is a nidus, and you find that more and more substances are getting attached onto it. That particular diagram you people will have to trace, and I have explained it vividly in my class. The complications and other things. Histologically, it will lead to chronic inflammation called chronic cholecystitis. And the hallmark will be Rokitansky ash of sinuses. So that completes the gallstones. See whether you are able to trace all this. Next one is pancreatitis. Surprisingly, both acute pancreatitis as well as chronic pancreatitis, they are repeated questions for us in pathology as well as in surgery. Now, for pathology alone, we shall be concentrating on it, and I will be showing you just a mnemonic which I have pasted in my classes also. Look at this one. So I get smashed. This kind of mnemonics are a lot in my classes. I would like you people to kindly by heart. The most common ones, however, will be alcohol and then viral infections. So please be familiar with it. And what will happen because of the inflammation? There will be a release of lot of these enzymes, and they will be leading to fat digestion and almost an empty cystic space. There can be fat necrosis also, and this has to be quoted in your general pathology. So what happens will be that. So acute pancreatitis and chronic pancreatitis are important questions. I hope you people will be able to trace the answer. And these are the causes. The next important topic will be diabetes. Diabetes can be asked as an essay or a short note in paper 1 as well as in paper 2. And you people would have already read the differences between type 1 and type 2 diabetes. Do not go too much into the clinical details, but then you will have to explain how each of this happens. So kindly go through my classes in RADS. Definitely it will pay you dividend. So there are the various things which are being produced, such as the advanced glycosylation end products, and there can be an oxidative stress, there can be a damage to the blood vessels. So what are all the complications of diabetes? Instead of saying just leg ulcers as well as a retinopathy, neuropathy, etc., we must explain how it happens. And In the kidney also, there will be lot of changes because of diabetes. There can be a glomerulosclerosis, arteriolosclerosis. There can be necrotizing papillitis, or there can be interstitial nephritis. All this you people will have to mention. Sometimes the excess glucose is being absorbed back and the tubules will show vacuolated cytoplasm. That is called Harmony-Epstein lesion. Now, why am I telling you people so much? Because you have got 15 to 20 marks in your long exercise, namely the urine, and invariably 50% of you are going to get questions from diabetes. So I would like you people to read this slowly and deliberately and not booming. The last one, which may or may not be asked in pancreas, can be the pancreatic carcinoma. So it can arise what are the various sites, what is the common carcinoma, and what can be the clinical features. Obstruction, obstructive jaundice, etc. That much will be more than enough for you people for the time being. Carcinoid syndrome, I had explained in the respiratory system itself. So we will just have it in mind. I repeat again, there will be the gallstones, cholecystitis, cholelithiasis, specimens as well as slides. Secondly, there can be acute and chronic pancreatitis. There can be diabetes mellitus as well as carcinoma of the pancreas. See you again in next class.